I wonder if we're not out of the gates yet in terms of being able to talk about reopening. Can you just clarify what the three legs of that stool for identifying our starting point, the diagnostic testing, the antibody testing, and contact tracing, or is there another step? It's confusing to know where we even start with a clear picture of where we are today.
Well, first of all, we have to do testing, but we've got to also stop talking about the way we have. We have far too many people that come on shows like this or write articles saying test, test, test. We have to understand we have a major shortage of reagents today. The world was not ready to suddenly supply all these test kits. And so it's not a matter of money, it's a matter of physics. We don't have the reagents yet. We have to build these manufacturing facilities to do that. Our government has not helped facilitate that. We needed a Marshall Plan to build that up. So testing is critical. We need it. Second of all, we have to make sure that we have surge capacity in our hospitals. So when the testing shows us that the cases are starting to come back, that we can handle them. We don't want to overload the hospitals. And by the way, that surge capacity doesn't mean just beds. It also means protecting our healthcare workers. The third thing that we absolutely must do in all of this is then do what you just said about contact tracing. Have a way so that we can constantly try to hold this virus down. Until you have those kinds of things in place, it's very hard to reopen and not get caught with suddenly this very rapidly rising number of cases.
Well, Doctor, you just said the magic phrase to me, the Marshall Plan, and I'll do it one better, a Manhattan Project. If this is indeed going to be the event that perhaps marks the rest of our adult lives as Americans, why not?
Well, actually, in an op-ed piece that I wrote in the New York Times almost a month ago, in which I predicted we'd have the shortage right now that we see of reagents, I actually did call for a Manhattan Project, an intellectual one that covers all these issues. My Marshall Plan is just about testing reagents. But I think you're right on the mark, Brian. We need to bring together that right now. And what this country is missing is a core. We're missing a leadership component that can bring everyone together without regard to partisan politics, without regard to age, race, gender, location. You know, I said on your network just 3 weeks ago that one day it wouldn't be a red and blue issue, it would be a COVID color issue. Look what's happening in the Midwest right now. All those red counties are turning COVID because of what we're seeing happen. So I think that you're exactly right. We need a Manhattan Project where, one, tell the truth. We need straight talk. What's really happening, what's not. I don't want to hear another time we have enough testing. The 50 governors will tell you that's not true. We need to understand, are we going to have more cases or not? Don't tell the public we're not going to have any more cases because they may go away with more sunshine or warmth. There's no truth to that. That's like defying gravity. So I think that's part of what will make a Manhattan Project work if we all come together to solve a common problem that is this virus. And it's going to be here for a while. So let's get on with it right now to doing that.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.